Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Tushar Mehta. He's here to discuss about the current situation, the pandemic, how to overcome this, how to get over this. There is lot of confusions, lot of emotional and mental stress going on among the doctors, among everybody around, the layman doctors. Everybody is facing the same. And he, being a leading motivational speaker, has been motivating all of his students, and every medical student who has passed his graduation has known him. So welcome, doctor, to the platform. It's really nice to have you here.
Okay, thank you so much, Dr. Arishi. Thank you so much for
Yes.
the welcome and the introduction. Thank you.
Yes. So, sir, now with this situation, how do you think, things are going, and anything on your take on the situation?
See, well, whatever the situation currently going on all around the country, the first and the foremost thing is that, there are a lot of reasons behind it. There are, probably we were careless a bit. And of course, then the mutation of the virus. And, India, I think, probably did not believe in getting vaccinated that much. So there are multiple fallacies that have happened not only on the part of administration but also on our part, which has led to this thing. But whatever has happened has happened. I personally feel that when there is any time of chaos or when there is any time of this kind of a calamity, there are only two things that can keep you sane. One is your mental strength, that how strong you are mentally and how capable you are of tackling the things in your own space, in your own mind. And the second thing is that how resourceful you are. So I personally feel that at this moment, every Indian, whether a medico or a non-medico or anybody, should be contributing to this pandemic in his or her own way. That is either by creating awareness, as I'm sure your platform, the Social Doctor, is doing, or trying to help the people out there in the field, or doing the bit, doing your bit, whatever best you can. It is not, these are unprecedented times. See, we have to understand. I mean, something like this happens in centuries. I mean, the last thing that we've heard was something which is, I'm sure, which everyone knows now, by the Spanish flu, which we have heard, ki kabhi hua tha ek time pe.
Correct.
So it is an unprecedented time. It is going to be written in the in the textbooks. There will be literature about it. The people will, maybe 50 years, 70 years, or 30 years down the line, people are going to Google it. That you will have a story. If at all we survive, we have a story to tell to our kids, and I'm sure grandchildren also, that something like this happened. So this is an unprecedented time. As of now, we are not looking. We are not able to see the other end of the tunnel. It's all blind. It's all dark. But now, with the experience of the first wave that happened last year, I mean, I'm still a bit hopeful, although the situation is bad, but I'm still hopeful that we'll be able to make it.
Correct. That's true. So now when you mentioned about mental, keeping yourself healthy in your mental space, so what exactly do you mean by that, and how can students and doctors do that?
First of all, when I talk about a student, a medical student,
Yes.
um, there's something that I feel has, it has got a lot of baggage on it. I mean, if you're a medical student, you are doing, MBBS or BDS or whatever it is. I personally feel that, you carry a lot of baggage. You carry a lot of responsibility on your head. I mean, you are not only into the science of, you're not studying only the science of medicine, but somewhere down the line, in that science of medicine, I'm sure all of the doctors who are listening to this must be aware of this subject called preventive and social medicine. It is called preventive medicine.
Correct.
So what I personally feel, and what I've been feeling for the last 7, 8 days, is that medical students should, first of all, their first job, their first responsibility is to create awareness. I've been telling this even before the second wave started, that you have to create awareness about the vaccination in the people who are above 45 at your home.
Yes.
You have to tell them what are the pros of the vaccination. You have to get them vaccinated. It is your job. So that's the first thing that I was telling. Now, as of now, I just want them to ensure that their family, their loved ones, their people who are nearby, they don't fall for all these, WhatsApp messages, and what this kind of a fake WhatsApp university which has been created. That, I saw a video yesterday that somebody was, I'm sorry to say, but he was a doctor himself. He was telling that how you can use a nebulizer as an oxygen concentrator. So that is scientifically wrong. So if you see any sort of that video, you should try to find out the reason behind it. Like, I'll just give you one small example. Yesterday there was a message again which was floating that, from 1st of May there will be opening vaccination for all the women. There will be opening vaccination for everybody who's 18 above. So there was a WhatsApp message which was circulating that all, women who are either menstruating or pregnant or lactating should not go for it. There's no data about that. There's no scientific study about that. And this was a message which was circulating, and I, by the grace of God and by the love of the people around me, I'm connected to thousands of medical students pan India. So I kind of circulated, I kind of formulated a message where I, wrote down that, these are the protocols, and this says that nothing like this is true. And then I could see that it went viral, and they all were trying to educate people around them, and they were trying to, put this informed kind of an information everywhere. So this is what I feel, that as a medical student right now, your first job is to be a part of the system, is to feel that you're a part of the system. I mean, I see a lot of messages, sir, I'm just a medical student, how can I help? I said, you don't use the word just. You are a medical student and you are helpful, and at least 5, 10, 15 people will listen to you. Creating awareness is one of the most important tools in stopping the panic of the pandemic. Pandemic itself is a problem, I totally agree, but the panic of the pandemic is a bigger issue, which I think can be tackled with awareness. Therefore, I would like to use your platform to request all medical students to come forward, to create awareness campaign, to create awareness program, and to make sure that there are people around them, they have a well-formed and a well-informed mind. So this is my request to all medical students and graduates, MBBS, BDS, everywhere.
So correctly said, sir. This situation needs to, that everybody needs to pitch in and to help in each and every way. So now coming back, to that. So obviously, medical students should create that, but how can they be mentally, healthy? How should they keep their mental peace is a big question, because seeing so much fatality, so many cases, so many problems around, how should they keep a peace?
See, I'll tell you what I have. I mean, I'll tell you. I'll share my own experience with the first lockdown that happened last year. It happened somewhere in the end of the March. So for first 10 days, I still remember for the first 10 days, our entire country, not even the doctors or everywhere, they kind of thought that as of now, survivability is a priority. If we survive, that's all what we want. So
Hmm.
Zinda Rehna, that's all what we want, that we should be alive. Then another 10, 12 days later, by the mid-April, somewhere down the line, people realized that this is a new normal and this is how we have to live.
Correct.
So everybody started, doing some household activities, some started cooking and some started baking and everything. Then another 10 days later, 12 days later, people started taking it as a holiday. लोगों
Hmm.
को लगा, छुट्टी हो गई है, बस अब तो ठीक है, it's fine. So
Yes.
that is what I'm trying to convey here, that an empty mind is a devil's workshop.
Hmm.
So if you have an empty mind, then only these things can accumulate into your mind, that fatalities are happening and oxygen is not there. I totally agree
Hmm.
that there are certain resources which are not available, and this is creating a lot of panic and a lot of havoc all around us.
Hmm.
But if we have to mentally calm down ourselves, the only way is to go forward about it, and not to waste time on just talking about it, discussing this, condemning the administration and talking about that this is not there, this is not there. I agree, this is not there. I totally agree that there are certain lapses, but these lapses are on both the parts. They are either on the part of the administration or on the part of the public of the country as well. But we have to understand that we have to work hard for it as best as possible we can. As far as keeping the mental calmness and the mental sanity, the
Correct.
only way which I feel is to try to keep your mind engaged. Because if I tell you, okay, there are certain people, I mean, I've been touch with them, they're saying they meditate for 5 minutes, listen to the music for 10 minutes. What I feel is that karma is the only thing that is going to take you forward. So mind is got, it has got, brain has got a limited capacity of 1400 cc. So if you bring in a lot of negativity that, oh shit, India is dying, it is burning and things are bad, then you will not have a positive input to create something that you want to. So in order to do some effort, in order to even create awareness for 10 people in a day, you have to first empty the negativity from there, and
Yes.
then you have to move forward.
Correct.
So my space right now, like my mental space, I'll be very honest, 3 days ago in the night, I kind of broke down because I could not help, anyone. And one person whom I knew, he passed away because of very simple thing, because of the lack of the oxygen that they were not able, they were not able to avail. So for 2 hours, I realized that things are not that simple. But another 2 hours later, I realized that what choice do I have? We don't have a choice right now. I mean, this is not the time where I can ask you that, okay, can I do this? Can I do this? No, this is the time when I can not even ask you. I can tell you that, Dr. Aishi, this is the only thing that we have to do. So you have to be at the forefront, either physically or digitally, as you've been running this campaign. So I advise all the students to just keep one thing in their head, that there is no time to be wasted in the name of some sort of a pessimism. You have to be optimistic, and that's the only way with which you can move forward.
Correct. Correct. That's so correctly said. And actually, Dr. Ankita Sharma is also asking one thing. Sir, I want to ask one question. How can we overcome death of loved ones in all this chaos and still contribute to this pandemic? Because mind is so full of that frustration of losing father that you feel nothing to do.
Well, Ankita, I first of all, I really, I'm sorry for the loss that has happened, and not only, in fact, I will say that I'm sorry. I will say that, not only I regret, but I apologize, because as a part of the system, as a doctor, being a doctor, I think that we have failed, we are failing, but we will try not to fail ahead. And I totally agree. And honestly, though, I can say that I cannot even understand the emotion that you must have been going right now. But at the same time, I can tell you only thing that your father, wherever he is, he must be he will feel proud of yourself. He will feel proud of you, because of the only fact that probably he must have been wanting you to do good for the society. So you can take it like that. I mean, it's just a suggestion. You can take it like that, that probably his last wish, or his only wish, or his one of the wishes was to see you doing good for the society. आप यही सोच सकते हैं कि वो कहीं ना कहीं इस बात से जहां भी होंगे वो खुश हो रहे होंगे कि आप जो शायद सुविधा उन्हें नहीं मिल पाई, द काइंड ऑफ फैसिलिटी दैट ही कुड नॉट अवेल. आई थिंक इफ यू वर्क 1% of it to avail for the others, I think that is probably the last kind of homage that we can pay to your dad. I mean, I can totally understand that मेरे शब्द काफी नहीं हैं ये सब आपको समझाने के लिए. But yes, time is the best healer. Nobody else can heal you. And I'm really apologize. I really apologize for the loss that you have. But still, you can try. And I assure you that many doctors they have gone through the similar kind of a tragedy, but still they are working hard their level best to make the ends meet.
That's so true. So this is something, actually, Dr. Ankita, it's really really sad, and all all words stay short for all of this.
Yes.
So now, with discussing about the mental health, there are many doctors who are getting physically also exhausted with this pandemic running for so long now. It's getting very difficult for them to to manage everything, especially now. It's getting, hospitals are full, it's not able to manage the whole situation. How, what will you suggest for them to to take care of themselves also is a very important thing, apart from taking care of patients. So anything from your end?
Well, this is my only concern right now, because I know that beds are full. I know that resources are almost exhausted. But I tweeted also a while ago on this that remdesivir is not available, oxygen is not available, beds are not available, ambulance is not available. What if one day you come and say the doctors are not available?
Yes.
So doesn't matter how much money you have, doesn't matter how much resources you have, but if a doctor won't be there, or a healthcare worker won't be there, then what will you do? So you have asked a very valid question. Uh, I will advise here that we have to follow the system of hierarchy. I'll tell you. Yesterday itself, I was talking to someone. They are trying to set up a 50 bedded isolation facility. So I was talking to a couple of resident doctors, and I was encouraging them to come and join us for that facility.
Mm,
So the doctor told me that, sir, it will be a little tedious and it will be a little exhausting. So I just told him one thing, that when something like this happens, you have to take an inspiration you have to take inspiration from the people who are one level above and one level below. If a medical student or a resident doctor is getting exhausted, I have spoken to many of them. They tell me, sir, I'm working just because my HOD or my senior, who's 50 plus, who's diabetic, who's hypertensive, who's having comorbidities, who's most likely to develop COVID-19, and even probably the complications might happen, that person is still so overzealous and enthusiastic to come and see the patients in the COVID ward, that I feel ashamed that I'm trying to kind of avoid that situation. Plus, now one step below, there are a lot of sanitary workers, there are a lot of GDAs, there is a lot of other paramedical staff which is working relentlessly in a COVID ward or in a COVID ICU. So when you see them working so hard, and then you feel that you are just probably tired for a bit. It's a transient rest that you want, but ultimately you have to get back to your duties, for which you kind of assigned yourself after the 12th boards, that yes, I will take biology and I'll become a doctor. So when you assign your mind to become a doctor, then definitely it was supposed to be tough. I mean, I'm sure that it was not supposed to be that much tough that we have right now, but कहीं ना कहीं उस चीज के लिए हमने assign किया था अपने आप को. Now, as far as your exhaustion is concerned, my advice to many residents, which I've been giving for last couple of weeks now, that whatever time that you take out, I'm sure being in a PPE kit, I've been in that for a while now. So staying there in the PPE kit, managing COVID patients, and trying to make the ends meet, it is an exhaustive task physically as well as mentally. But as far as the physical strength is concerned, you have to take care of yourself first. I mean, this is where I want the resident doctors to be a bit selfish. It is I don't feel good also while saying this, but here I want you to understand that first of all, you are the priority. See, if a resident doctor is not well, then definitely it is going to create a loss of attending almost 10 to 15 patients, or even more than that in certain setups right now. तो अगर आप ठीक नहीं है, आपकी तबीयत ठीक नहीं है, तो आप कैसे बाकी लोगों का ध्यान रखेंगे? तो आपको अपने आप को प्रायोरिटी लेके चलना है. If you feel that you are developing any of the symptoms, get it tested there and then.
mm,
This is something which I have heard, I will tell you very honestly, from the senior doctors even, कि I had cold and I had cough and I thought क्या होगा, ultimately कुछ नहीं, COVID ही है, थोड़ा बहुत एंटीबायोटिक ले लिया ठीक हो जाएगा. नहीं, you have to take care of yourself first. You have to keep yourself priority. You are not supposed to think that no, it is my line of job and I will not do this and I will not take a leave. Please get yourself tested. Please isolate yourself, because you are going to be in touch with 15, 20 people minimum. You can be a spreader even. So if at all you develop any symptom, you please get yourself tested and isolate yourself. Now, as far as the physical exhaustion is concerned, whatever time, 5 hours, 6 hours, 8 hours, whatever you get apart from your hectic duties that you're doing, please take a good sleep. First thing. Second thing is that try to listen to some music, or try to talk to some positive people in your family around you. uh, I think that it is our duty, my duty, your duty, everyone's duty, to motivate these resident doctors and healthcare workers. And I mean, I'm already looking into it. I have spoken to a couple of people that how can we arrange a Zoom session where these people can attend those session, and we can just maybe just sing a song for them, just to encourage them. So this is something that I want all the resident doctors to do. To try to find some peace and some solace also in these hectic hours, because ultimately, if you will be fit, then you can help thousands of others patients.
that's so correctly said, and actually that was the reason of my question also, because doctors at times just neglect themselves taking care of the patients, and that is very important.
Yes.
Thank you so much, sir, for this insightful idea on this,
Thank you.
your suggestion on this. So now, they are taking care of them physically as well as mentally. Third part comes the emotionally. As Dr. Ankita also mentioned, losing loved ones, also not losing loved ones, the idea is, me as a doctor also, I feel that seeing so many cases where you cannot help, where you cannot manage, you know where you see patients crying, calling you, please bed dila do, please ye kar do, please wo kar do, and everything. How do you do that?
It is
So
a tough
this is something that you also are dealing with, so I want to understand, how do you do that?
It is a tough task. It is a very, very tough task. I'll be very honest in telling you that since morning, last whatever 4 5 hours that I'm awake, I have kind of refused almost 15 people that I won't be able to help here personally, physically. But yes, I can tell you certain ways to go about it. It is painful. It is very, very painful. But there are certain times of helplessness or worthlessness, that where you feel that you are not able to contribute to the cause of the society.
Yes.
But how to deal with it? It's a very simple thing that whatever you cannot, whatever you cannot do, you're not going to cry over it. But whatever you can, you're going to make others happy because of it. सो मैं क्या नहीं कर पा रहा हूँ, मैं उसको लेके सॉरी, मैं उदास नहीं हूँगा, लेकिन मैं क्या कर सकता हूँ या मैं क्या करने जा रहा हूँ, मैं उसको लेके आई फील हैप्पी कि मैं लोगों की मदद कर पा रहा हूँ. तो फर्स्ट थिंग फर्स्ट, जैसे मैंने आई सेड इन द बिगनिंग ऑफ द कॉन्वर्सेशन ऑल्सो, that there are certain things which a person can do and there are certain things which a person can't do. As a medical graduate, as a medical student, as a BDS or MBBS resident doctor, you can create awareness. You cannot ensure that somebody gets an RT-PCR done on the same day and get tested and the results come and all those things, because you are not that much indulged into the system. So what you can do is best at your level. What I'm doing is best at my level. What many other doctors are doing are probably best at their own level. So we all have a role play. We all have a system in the pot. The only thing that hurts me is certain people, though being influential, though being powerful, though being resourceful, they are not contributing. So that is my hurt. I mean, I'm very strongly against this word. I'm taking another 2 minutes to answer this. I'm very strongly against this word called as influencer. So मुझे बहुत irritation होती है इस word से. I don't know why, but yes, I know it is it is something which is quite fashionable these days, that people have a social media following and they themselves call them as influencers. And but honestly, for last 1 week, I've loved I've started loving this word, and I've started loving these all these people. The people who have nothing to do with medical profession, they are into the field of fashion, they are into the field of blogging, they're into the field of food. They are posting all the leads, and there are a couple of profiles that I came across on Instagram, and they are from Gurgaon itself and the city that we live in. And they are not only posting the leads, they are verifying it. They are mentioning it that yes, I have called at this number, this bed is available there, I have verified it is verified at 1 10 a.m, and please you can take the lead. I've seen 2 3 influencers, and of course I don't know them, but they are going to the hospital and they are doing a live streaming from there, that oxygen is available here and something is available and something is available. So what I'm trying to tell you is that it is very difficult to deal with the fact that people are asking for medicines like remdesivir, or they're asking for beds, they're asking for oxygen. But somewhere down the line, spreading information, creating an awareness itself is your job that you are doing. So
Correct.
that is a kind of the moral responsibility that came along with the civic right in the country. But
Correct.
yes, everybody has got a level in the hierarchy. Like I can arrange certain things in my city because I know the people here, I know the system here. So that is best for me right now. But there are certain things which are best for you, for everyone who's listening to this. So try to do the best in your own capabilities and abilities and capacities.
Correct. That's so correct. So Dr. Prince has also mentioned something. He's saying, sir, one experience I suffered too. Residents and doctors in service already trying to put their best in service or COVID duties, but somewhere we are all occupied by many kind of negative elements. Continues to make sort of tortures in the form of pressures, movements, documents, or transfers. Sometimes we just give up because doctors are still soft creatures for these creatures hidden in departments or societies?
See, I am totally understanding what this gentleman is saying. He's talking about the typical administrative work, which sometimes comes in the way of the work that we are doing. And when you are dealing with a pandemic, you are dealing with a critically sick patient. You definitely want to focus on the medical care, not on the administrative care. Buddy, I would like to tell you one thing very clearly that human beings, we have got a power to think, and we have got a power of when to think, what to think, and what not to think, and when not to think. हमें क्या करना है ये हमें पता होना चाहिए, और हमें कब क्या नहीं करना है हमें ये पता होना चाहिए. Even Facebook has given you, I mean, the social media platforms have given you a button of mute, a button of ignore, and a button of block. So I'm very much convinced with this fact in my own life. Like in my life, every day, I mute certain people, I ignore certain people, I block certain people. So even though you're in a job, you're a resident doctor, you might feel that there are certain seniors, maybe certain colleagues, maybe certain non-medical bureaucrats, certain non-medico administrative officers who are working, as a part of the the COVID task force, and you feel that they are blocking your capabilities of helping patients. So there are only three things. You first try to ignore them. I would advise you, because I've been there, I've done that. So that is why I'm saying this with a lot of experience. So when anybody used to try to do this with me, I was very vocal, and I've been always very aggressive with this. So I ignore. Then if at all it doesn't get solved, then I mute. If at all doesn't get that solved, then I block that person, because I feel that any person who is stopping me from following my priority. Like my priority is to handle a patient. And if a person is stopping me from handling my priority right now, then I have the authority to block that person. And whatever the consequences may be, I'm capable enough to take care of them. I mean, I'm saying this, I did this as an intern. So don't quote that thing that, sir, I don't have that much amount of power. You have power. The only thing is that you have to realize it. And after realization, you have to execute it. So please go ahead. I can totally understand the problem of the resident doctors, particularly who are in service. They have certain non-medico, hands which are blocking their way, and there are certain people who want things to be done in their own way. Follow this principle of mute, ignore, mute, and block. That'll help you.
That's amazing principle. This is something very nicely explained, sir. So Dr. Mohammed Jamil is asking, healthcare workers definitely need to be morally strong. The nation is looking for them after God. What's your opinion for the need of an integrated corridor for the doctors and healthcare workers to share their concerns and challenges and try to mitigate them in the public administrative domain?
See, I totally understand, and I totally appreciate what you are saying, but creating a forum for that, or creating a campaign for that, or creating something like that, probably that's not the need of the hour. I totally appreciate whatever you are saying. Whatever I got from your question is that you are asking that healthcare workers, we have our own issues, and how do we convey our concern to the higher authorities? I think probably that is the question, right?
Yes.
So I don't think that we it is the right time to do that. The right time is not to talk about our concern. The right time is to talk about the concerns that this country of 130, 135 crore population has. So we are right now, we are more concerned about that. We do have our concerns, and I'll be doing this job which I don't like. Will be like washing the dirty linen in the public. But yes, I'll do that for a minute. Whatever concerns that we people have, they don't get to the top of the administrative services, and they don't get solved only because of the lack of an ethical hierarchy in the medical system right now. Whatever problem an intern has, I've never seen, I mean, for last decade at least, I can say I've never seen a junior resident or a postgraduate resident solving that problem of an intern. Whatever problem that PG resident has, I don't see an assistant professor coming and helping him out. Whatever problem that AP has, I don't see a unit head or a HOD coming out and being vocal about him. You have to understand this. Like, I'll tell you, there was an exam which was going to be conducted on 18th of April, the NEET PG.
Yes.
अभी नीट पीजी होना था. आई थिंक उसके अराउंड 5-7 दिन पहले जो है, आई केम अक्रॉस अ कपल ऑफ स्टूडेंट्स ऑन सोशल मीडिया वेयर one student messaged me that, sir, how about this drug called as Medrol? I said, why you want to know about it? They said, sir, I'm COVID positive. I have hardly any symptoms. There's just a mild fever, and I'll be appearing for the exam. And I want to know that, can I take steroids so that I have a feeling of well-being and I can perform better in the exam? I was shocked. I was shocked. In my entire medical educational career, where I was a student in MBBS and post graduation and thereon, I've never taken. Forget about a propranolol or any beta blocker. I've never taken even a zolpidem, which is normal anxiolytic taken by many medical students in the colleges.
Yes.
So I said, beta, if you're COVID positive and if you think that you have symptoms, first of all, it is about you right now. You are not supposed to take up the exam because you're not well. Why do you want to travel? Why do you want to exert yourself? And she said, sir, this is the life. This is my life. I said, no, this is not your life. This exam is a very small component of a very large exam called as life. Life is a bigger exam. This exam is very small in front of that. So why do you want to do that? She said, sir, no, sir, I want to take up this exam and this is my life. And I just want you to tell me that taking the steroid is safe. Then I realized that there are many students who are COVID positive and they'll be going for that exam. And not only they will hurt their own life, they will damage their own, vitals, but somewhere down the line, they'll become spreader for others.
Yes.
So that is when I started tweeting that, we have to postpone this exam. And I wrote a kind of an open letter also to the health minister. And I got kind of support from very certain section of the students. But when that delay happened in the night itself, I got a lot of bashing on social media, on Instagram, on Facebook. There were random anonymous profiles writing, bullish things about me, that why did you get this postponed and why did you get this postponed. I did an Instagram live on the same night asking everyone that please don't do this. This is something which is required. And 3 days later, I got messages from many students that thankfully it got postponed because today my father tested positive or my brother tested positive. My father was having symptoms for last 6 days. He must have accompanied me to the exam center. He must have interacted with a lot of people. He must have been the source for infection for, many other people. So what I'm trying to tell you here is that it is the problem in the ethical hierarchy of our system that seniors don't speak for the juniors. एंड दिस इज बिकम अ चेन रिएक्शन. ये एक फ्यूजन रिएक्शन बन गया, ये एक चेन रिएक्शन बन गया कि भाई मेरे सीनियर ने मेरे लिए नहीं बोला, मैं तुम्हारे लिए क्यों बोल रहा हूँ, मैंने तुम्हारे लिए नहीं बोला, तुम उसके लिए क्यों नहीं तो क्यों बोलो. बोलना जो है, मैं बोलने से मेरा मतलब, आवाज उठाने से मेरा मतलब सिर्फ कोई जो है बीइंग रेबेलियस नहीं है. मैं कोई बागी नहीं बनना चाहता हूँ. इट्स जस्ट दैट आई फील दिस इज नॉट good, this is not ethical, this is my junior and he needs support, he needs moral support, he needs physical support. I'll be there for him. So I'll be very honest that till the time we don't achieve this kind of a ethical hierarchy, we don't achieve this kind of a unity in the medical fraternity,
Hmm.
there is no point in making a forum for our concerns and taking to the top. You have to understand, 100 people, if they are worried about something, first they have to come on a similar platform, and then you can get the problem solved from the people above you. So anyways, it is not the time for all this. The time for this will come surely, and then I think I will be able to do it.
No, sir, what you have mentioned is actually correctly said. There were a lot of people who were like, kyun ho gaya? Because see, people are preparing since years, 2 years, 3 years. But yes, what is important right now is important. Correctly said. So now coming to this, as in the start you mentioned that for keeping your mental health, in place, you should keep your mind engaged. What I understood. So now keeping your mind engaged is another one thing, which is very important to understand how to do that. Because for doctors who are working, for residents who are working, that's a completely different game. But for students who are from colleges are shut, there are online classes going on, there are studies going on, but still to keep completely engaged, to keep completely active, and to keep in focus is becoming a bit difficult for them also. So as now healthcare is also evolving, healthcare is changing, the way of dealing with patients is changing for everybody. Since the last year, we are seeing how things are changing, how it is evolving, how things are going online, how patients are also adapting to this. how now there are many people, many patients who are actually, who have started taking online consultations only because of, the convenience or any other reason. So how, what do you think now are the important skills that a doctor should have to get adapted to the current scenario? And this is especially for the students who have time right now, who want to understand what all they can do for their future life.
See, I'll just rephrase the thing that, okay, I'll tell you, a student, first year MBBS, second year, third year, BDS, any course, who's not into active COVID duty.
Yes.
Okay. My first suggestion, being a senior, being an elder, is first to prepare a kind of a timetable on a daily basis for yourself. I can still see, I still know, I am still aware of certain people who are again taking this as a kind of a second holiday of 2021. Of course, Dalgona coffee is not there this year, and all these, challenges on Instagram are not there this year, but still there are many people who are still taking it as an extension of the holiday. कि चलो ठीक है, इस साल भी छुट्टी हो गई है. So first of all, I want you to understand that this is not the time of a holiday. This is just like for you people who are not into active COVID duties. This is just like a, another phase of your life where you are devoid of certain things which are mandatory for you.
Yes.
I mean, I was in MBBS. I know that if I was in first year MBBS and I could not attend the practical lectures or dissection hall or maybe the second year, pharmacology practical or microbiology practical, and I don't know how to do a ZN staining because you are hardly going into the medical college, you are hardly attending the clinical ward rounds, you are hardly attending the bedside clinics. So you are losing a lot.
Yes, that's true.
It is not going to happen that you or probably the system is going to say next year, oh, that last year we could not give you bedside clinic, so we will take an extension of 6 months into your MBBS to provide you the clinical kind of teaching. No, nobody is going to be bothered about this. So it is the time where you are supposed to be bothered, for yourself.
Correct.
So you have to utilize this time. You have to utilize the resources. First of all, by what? By making a timetable for yourself, by prioritizing that, okay, fine, this new series has come on Netflix, you are supposed to see that, but at the end of the day, this has to be not your daily routine that you wake up in the morning. Rather, I would say for most of them, you wake up in the afternoon, you take your whatever lunch brunch you have, and then you try to find out कि यार Netflix पे कुछ नया नहीं आ रहा है, Amazon Prime पे कुछ नया नहीं आ रहा है, because I know many of the people, even the medical students, are doing that. So for them, I have a very strong message that जिंदगी पड़ी है इन सब चीज़ों के लिए. फिलहाल जो आप खो रहे हैं आपके मेडिकल कॉलेज की क्लासेस ना होने की वजह से, आपको अंदाजा भी नहीं है इस वक्त कि आप क्या खो रहे हैं. जब आपको अंदाजा होगा, आई कैन अश्योर यू बहुत देर हो चुकी होगी. तो फर्स्ट थिंग इज टू मेक अ टाइम टेबल फॉर योर सेल्फ that okay fine, just you have to believe as if everything is the normal for you. So you get up in the morning, you fix a time, you get up by that time, you make your own bed. You make your own bed because that's, I think, is the first thing to come in discipline. And then you start studying as if that you are in a medical college. I mean, I am a part of a educational institution called DAMS, where we train doctors who have done their MBBS. We train them for PG entrance, and we've been running online classes. I mean, when last year all this happened, we never went for any recorded versions that, okay, fine, we'll give you some recorded. Like, we conducted live online lectures, right? Like, even now, there is a live lecture which is going on our app. Uh, so I want you to take care of the alternative resources that you have, but you have to be in touch, you have to be in sync with the education component, whether your college is conducting or not conducting any offline or online classes. First thing. Second thing, eventually you're going to become a doctor, that is for sure. The technology is going to play a very, 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 very important role in the part of the medical practice that is going to happen in 2022 or 23 or 24 and onwards. So my suggestion to you is that try to get the hang of it. Try to get the hang of it. When I'm saying that, what do I mean? I mean that you have to now start exploring many online journals. Like, I'm a big fan of PubMed. I always tell every medical student that whatever topic that you study from your textbook or from us, after that you go back to the PubMed and you try to search an article, because when you study a topic theoretically and then you find it the clinical aspect of it and in the form of an article or in the form of a study, you kind of develop a 360-degree picture of that topic, that okay, how this is patient is going to present, these are the symptoms, these are the signs, this is how a doctor is going to manage, and these are the possible treatments, and this is how the treatment is going to, the patient is going to respond to the treatment.
Hmm.
So it is the time for active learning. It is the time where you first divide your day into certain parts. Like I advise you that you divide your day into 7 hours of sleep, and whatever remaining 17 hours that you have, you divide 17 hours into 3 hours of leisure, whatever Netflix or whatever you want to do. You are living in a society where you can go out for a walk. Please do that. Don't just be a douchebag. So out of 17 hours, you have to give 3 hours for your leisure. Then remaining 14 hours, I would advise you to give 2 hours at least to your family if you're staying with them, because most of medical students are back from the medical colleges now. They're not in the hostels. So at least 2 hours you have to give it to your family for the domestic chores, for the everything, utensils and everything,
Yes.
because it is a part of your job also. So another 12 hours you divide 6 hours and 6 hours. 6 hours is for your active study, for your subjects. Like if you're in second year, third year, you have to, the academic component should contribute at least 6 hours a day. And the remaining 6 hours, find, do anything. I mean, there's Kindle, there are hard copies, there are books, there are good authors. I personally feel a man is, I mean, there's a saying, a man is known by the friends that he keep. I personally feel that a man is known by the books that he reads. So be a voracious reader. Use this time to be inside your home and try to read as much as you can, which can inspire not only you, which can see, you are in an age and stage where a medical student is around what, 19, 20, 21, 22 years of age. What I personally feel is that this span of, from 17 years to 22 years, this is a very malleable and a very ductile phase. So you can actually mend it, you can bend it, you can change your vision, you can develop a new tangent of thinking, and you can nurture yourself with some inspirational people, books, material, knowledge, education, lectures, journals, online portals around you. So try to explore Netflix and movies and Amazon Prime and all these online games. There's life for that. जिंदगी पड़ी है उसके लिए. तो अभी आप इस्तेमाल करें जो भी ऑनलाइन मटेरियल आपके आसपास अवेलेबल है, और एंड ट्राई टू डेवलप अ न्यू काइंड ऑफ अ टेंजेंट एज यू must have been doing while you were attending a bedside clinic in a medical college. So you have to pretend that you are following the same but in a new normal.
Hmm. Hmm. Hmm.
But that is possible only if you make a kind of a timetable first.
Yes, yes. That's so amazingly, mentioned, sir. Making a timetable is so much important and very correctly said. So now when we understand for the students and for the current students, as you mentioned that NEET PG has been postponed for BDS students as well. The results are out in December and there's no counseling since the last 3, 4, 5 months. People are in the loop of uncertainty, what to do, what not to do. Any suggestions from your end for them? What should they look forward to and how should they keep their mental peace in this case?
See, first of all, those people who are done with their exam, their results are out and they're waiting for the counseling. I can totally understand the agony, the pain, because I've been through it when I gave my PG entrance exam, my state PG entrance exam. We gave the exam, result came out, and we got the ranks. We were about to join, and suddenly something happened, and that exam was considered null and void. And we were supposed to take up the same exam. About, I think, 20 days later, there was a new date which was announced. There was a kind of something scam or something that happened, and the government said that it's a null and void exam and we'll do it again. So that 20-25 days of uncertainty, where not only we were preparing for the next date for the which was announced, but everybody was kind of sad and mourning that okay, I got 7 rank, or I got 10 rank, or I got 11 rank. I could have joined this, I could have joined this. But somewhere down the line, there was a hope also that this time maybe I can even perform better and get a better rank and a better seat. So hope is the only word which is the most useful word in this entire thing that I've told you. So there is only thing that drives all of us, and that is hope. So if your results are out, your counseling is yet to happen. So just hope for the best that can happen to you. I mean, you are losing on time. I totally understand and I totally agree. But just as I said earlier, for the resident, for the MBBS, the students who are in MBBS, I'll say the same thing for you. try to pretend that things are sorted, and according to the rank, by now you must be aware of the fact that you'll be able to get this plus minus 10-15%. I agree, but you have to pretend, you have to make use of the time, because the situation, the circumstances are not like that, something definitive can be done. So I personally feel that a successful man is that who tends to mend his or her own ways and find a middle path and work on it. Now, I conducted a session also for all those people whose exam have been cancelled, and they are waiting that when this next date will be announced. My only suggestion to all of them is that that exam has been postponed. It has not been cancelled. The first thing that I want all of them to, if they are listening, you have to understand that exam cancel nahi hua hai, wo sirf postpone hua hai. As of now, what the data is saying or what the statistics are saying, although I have stopped believing in the data right now, considering the situation all around us, but the data says that we'll be able to achieve the flattening of the curve by the end of May, and hopefully the cases will fall down by the mid of June. I mean, this is what the leader and the statisticians, the leading statisticians, are saying. So I think that probably your exam will be in mid June or maybe end of June. So technically, you have 50-55 days. I'm sure that when you were preparing for the exam to be happening on 18th of April or whatever date that was, there were many things that you were feeling about कि अगर मुझे थोड़ा टाइम और मिल जाता तो शायद मैं ये खत्म कर लेता, या मुझे और टाइम मिल जाता तो शायद मैं वो भी पढ़ लेता. वो जो शायद शायद वाली चीजें थी, you can finish them now. So for that, what is required? For that, what is required is that the first thing is acceptance. The first and the foremost thing is acceptance. कि exam postpone हो गया है. I don't know why, but 5-10% people are still living in denial. So first thing is acceptance that exam has been postponed. Second thing in acceptance that it has been postponed, not cancelled. Third thing in acceptance is that I have to prepare again and ahead for it. Fourth thing is that whatever topics that left completely or probably I was not very sure of, I have to first, take a A4 size paper. I have to write all those topics on that paper. And my first job is to finish those topics, because when you will finish those topics, which you have never heard of or read of, that will kind of, give you a feeling of confidence and satisfaction कि यार ये अगर उस दिन एग्जाम होता और मैं जाता तो मैं इसको शायद पढ़ता भी नहीं, और आज मैंने इसको पढ़ लिया. So that should give you a sense of satisfaction.
Correct.
Because initially, when you start preparing again for the exam, which has been delayed, certainly the dates have not been announced. You have to think that you have to think that I was informed that around 1,70,000-75,000 forms were filled for this NEET PG that was supposed to happen on 18th of April. So I mean, you can just imagine that if you are not studying, quoting the word that there is a lot of uncertainty and how will I prepare, how should I prepare, even the dates have not been declared. I can assure you that out of 1,75,000 students, at least 15 to 20,000 students must be very intelligent, awake, aware, and alert that they will be using this time very judiciously. वो लोग इस वक्त पे वो इसको एज एन अपॉर्चुनिटी लेके चल रहे होंगे कि अरे यार सही हो गया यार, अभी 50 दिन और मिल गया, अब देखो क्या करता हूँ मैं. और यहाँ पे एक तरह की स्टूडेंट और हैं जो सिर्फ एक ही वो बार बार कहे जा रहे हैं कि पता नहीं कब होगा एग्जाम, कब होगा, डेट कब आएगी, ऐसे कब होगा, वैसे कब होगा. This is a time not to ask questions. This is a time to give your best input so that you can have the best output whenever this exam happens.
Correctly said. So correctly said, sir. And that's so true. So, after understanding everything for everybody, one thing I really want to understand from you, and actually to end this thing on a high note, is how do you keep yourself so positive? What is the thing that you do every day, or you read, or what is it that always keeps you high in your positivity and your, motivation?
I'll be honest in telling you one thing. मेरी एक line है जो I mean I'm very fond of using this line. I've been using this for last 5-7 years.
Hmm.
But I didn't know that one day the time will come that I will have to say it again.
Hmm.
It is not a practice or a habit that I do now. It is something that I've been doing for years. That whenever I get up in the morning and I have a habit of first trying to avoid my mobile. I mean, I just don't do that. Because normally क्या होता है कि जैसे I wear spectacles. Normally क्या होता है, जो लोग चश्मा पहनते हैं वो चश्मा पहनते हैं सबसे पहले उठने के बाद, they have a sip of water or not, और वो मोबाइल देखते हैं. तो
Yes.
मेरी एक आदत है, मैं मोबाइल सुबह कभी नहीं देखता हूँ. मैं चश्मा पहनता हूँ और उसके बाद I straight away go to the washroom and I wash my face. Then I take my toothbrush, I put the toothpaste, and I take good 3 to 5 minutes in brushing my teeth. And when I do that, the only thing that I do is I look in front in the mirror and I smile. And when I smile, that smile is for myself. बिकॉज़ अगर मैंने सुबह उठते ही अपना खुद का हँसता हुआ चेहरा नहीं देखा, तो मुझे लगता है कि मेरा दिन अच्छा नहीं जाएगा। बहुत ही सिली सी एक बात है ये, बट मुझे अच्छा लगता है ऐसा करना। और व्हेन आई डू दैट, not only I smile, but somewhere down the line, I thank God. And this is what I've been doing for years now. So when I'm brushing my teeth, not only I'm smiling, but I'm thanking God. Ki, "Yeah, God, thank you. You have given me one more day to live." Because probably there will be hundreds and hundreds of people in India and thousands of people pan, globe, जिनको आज सुबह उठने का मौका ही नहीं मिला होगा। मैं एक ही सोच के साथ, और ये आज की सोच नहीं है मेरी, कई सालों से मेरे साथ चल रहा है ये, कि बहुत 100 लोग या 1000 लोग ऐसे होंगे जो आज उठे ही नहीं होंगे। तो मुझे 1 दिन का और मौका मिला है, तो मुझे क्या, अच्छा मुझे कल का नहीं पता। मुझे कल नहीं पता कि कल मैं ये सेम टूथब्रश यूज़ कर रहा हूँ, नहीं कर रहा हूँ। तो जो आज का दिन मुझे मिला है, मुझे इसका बेस्ट यूज़ करना है। आई हैव टू मेक द बेस्ट यूज़ आउट ऑफ इट। So that kind of gives me a motivation that yes, with that 3 minutes of looking into that mirror and brushing my teeth and thanking God that you have given me a day to live, to survive, to make the best use of it, and probably I won't get tomorrow or not. This kind of thing, which is a kind of a motivates me from within. So it is a kind of a self motivation, I would say, because enough, मतलब मैं थक चुका था to get it from others and to seek it from outside. So I thought that now it is a time to create inside.
Yes.
खुद की फैक्ट्री लगाते हैं मोटिवेशन की। सो वो करते 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 आई आई यूज्ड टू स्टार्ट फील हैप्पी अबाउट माय वर्क, माय लाइफ, माय डे, बिकॉज ऑनेस्टली आई यूज्ड टू टेक one day at a time. I mean, I've been very fond of whenever there is a difficult time, I make short term realistic goals. मैं कभी भी ऐसे नहीं बोलता कि इतने दिन में मैं ये कर दूंगा, इतने दिन में मैं ये कर दूंगा। आई मेक शॉर्ट टर्म गोल्स, आई मेक रियलिस्टिक गोल्स, आई मेक अचीवेबल गोल्स, बिकॉज आई नो व्हेन आई विल अचीव दैट गोल, वट एवर इट इज, कुछ भी हो सकता है ये गोल। तो व्हेन आई अचीव दैट गोल विच आई नो इज अचीवेबल, बट आई deliberately set it like that, so when I achieve that, I sleep with a feeling of contentment, and that gives me a feeling ki that I've been this is my victory. So that inspires me to wake up even early next morning and to utilize more time to realize what I want to do. बट ये करते करते मुझे नहीं पता था कि एक दिन कोरोना वायरस आ जाएगा, और एक्चुअली में ब्रश करते हुए आई विल बी थैंकफुल टू गॉड कि गॉड माय ऑक्सीजन सैचुरेशन इज 98 एंड माय टेम्परेचर इज नॉर्मल. सो आई डिडंट नो दैट दिस इज गोइंग टू हैपन, बट यस, आई मीन दिस रियली हेल्प्स मी. Plus, I feel that on this planet, in this world that we live, लोग बोलते हैं कि there are two types of people, एक अच्छे होते हैं, एक बुरे होते हैं. मेरा ऐसा मानना बिल्कुल नहीं है. मेरा ऐसा मानना है कि इंसान कभी अच्छा बुरा नहीं होता, हालात अच्छे बुरे होते हैं. तो इंसान कभी गलत नहीं होता, कोई इंसान गलत नहीं होता, वो उसके हालात पर डिपेंड करता है. सो मैन इज एन अ प्रोडक्ट ऑफ द सर्कमस्टांसेस. सो I don't believe in that classification of good and bad. I believe in the classification of optimist and pessimist. So pessimist is that person who is going to complain all the time. He's going to complain, complain, and just complain. उसको हर चीज में नेगेटिविटी दिखती है. There's an old saying also that three people were sailing on a boat and suddenly सामने से तूफान आ गया. So जो pessimist था वो रोने बैठ गया कि अभी हमारी बोट डूब जाएगी, हम मर जाएंगे, सब मर जाएंगे, everybody will die and this will happen and this will happen. But there was another guy who was optimist. He was very hopeful. He said, "Naini, don't worry. Something will happen. Some magic will happen. We'll be saved and blah 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 blah." So I hate all these pessimism around me, and I encourage optimism around me, as I've been saying earlier. But then after this pessimist and optimist, there was a third person on the boat also. He was a possibilist. He was a leader. He was. When I say the word possibilist, possibilist means the person who feels that everything is possible. The only thing is that you have to make an effort for that. जिसको आप लीडर भी बोलते हो, बट आई डोंट लाइक द वर्ड लीडर, बिकॉज लीडर इज समथिंग दैट डजंट resonate with my thought process. So I want to call it possibilist. The actual story has the word leader in it, but I don't use that word. I use the word possibilist. So there's a third person. वो बोलता है यार सामने से तूफान आ रहा है, बोट को ऐसे मोड़ लेते हैं, तूफान के साथ साथ बोट को लेके निकल जाएंगे. So whenever I see a problem with me, within me, around me, with people around me, I just activate that mode of being a possibilist, and I want to troubleshoot that problem, solve it there and then, for anyone who's known to me, or I think that this mindset of waking up every morning thanking God for another day to live, to make it possible to the best of your sources, and being a possibilist to troubleshoot your problems, if you start believing that every day, one day it'll become a part of your it'll be a part of your personality. So I think that really helps.
Yes, yes, yes. And that's so nice to know all of this. And I'm sure me as well as many of our viewers will now implement that in their lifestyle, because it's, I always believe what you think is what happens. So this is so correctly said. You should, being a possibilist is another thing that now people should follow apart from being optimist. Thank you so much, Dr. Tushar, for this whole discussion, for this whole knowledge transition. I must say this is something that was amazing, that actually will help a lot of people as well as myself in understanding the situation, to cope up, to get through the whole thing. Thank you so much, Dr. Tushar, and thank you so much everyone for joining us at this time. I'm sure this discussion would have helped you immensely in understanding the situation and to sail your boat through it.
Thank you so much. Thank you so
Yes, yes. Do share this with your friends and colleagues who you think is finding it difficult to sail through the situation. They will actually feel motivated after this, and you will definitely do a great thing in helping them to go through, as well as Dr. Tushar said, be a part of the society in helping each other, to educate each other, to educate as much as you can, and to help as much as you can. This, I am so happy to have this discussion here. Thank you so much, everyone, for joining us. Have a nice day. Bye bye, everyone.
Thank you so much, everyone. Thank you being a part of the conversation, and thank you, Dr. Aishi, for such a nice initiative. And I'm sure your initiative, the social doctor, is going to help and is going to make a difference to many lives all around us. Thank you so
Thank
much.
you so much, sir. Thank you so much. Bye bye.